Medical English presented by English Fluently. In this video, you'll learn 5 essential medical words. First, I'll introduce each word with a clear definition. Then, you'll hear an engaging story where the word appears multiple times to help reinforce your understanding. Finally, stay tuned for a short quiz at the end to actively test your understanding and apply what you've learned. Biopsy. A biopsy is when a doctor takes a small piece of tissue from your body to check if it's healthy or not. The biopsy that changed everything. Sarah was worried. She had found a small lump on her neck that hadn't gone away. After visiting the doctor, he suggested she get a biopsy. Sarah didn't know what a biopsy was, so the doctor explained, "A biopsy is when we take a tiny piece of tissue from the lump to check if it's dangerous or not." Sarah agreed, but she was nervous about the biopsy. On the day of the biopsy, the doctor gently removed a small piece from the lump. "The biopsy will help us understand what's going on," the doctor reassured her. After a few days, Sarah got a call from the doctor. "Good news," he said. "The biopsy showed that the lump is harmless." Sarah felt a huge sense of relief. The biopsy helped her know the truth, and now she could stop worrying. The word biopsy wasn't scary anymore. It was something that helped her feel safe and healthy. Quick test. Multiple choice. What does the word biopsy refer to? A. A type of surgery. B. A medical test where tissue is removed and examined. C. A tool used for measuring blood pressure. D. A method of exercise. The correct answer is B. A biopsy is a medical test where tissue is removed and examined. Why might a doctor recommend a biopsy? A. To check blood sugar levels. B. To remove a large tumour. C. To examine a small sample of tissue for disease. D. To measure bone density. The correct answer is C. A doctor might recommend a biopsy to examine a small sample of tissue for disease. Blood count. The number of red and white blood cells in a person's blood, or a medical test to discover this. The mystery of the blood count. Emily was feeling tired all the time. She decided to visit her doctor. The doctor said, "Let's do a blood test to check your blood count." Emily didn't know much about blood count. The doctor explained, "Your blood count tells us how many red and white blood cells you have. It helps us see if there is a problem." Emily had the blood test, and a few days later, the doctor called her with the results. "Your blood count is lower than normal," the doctor said. "We need to do more tests to understand why." Emily was worried. The doctor decided to check her blood count again and do some extra tests. "We need to make sure we understand what is causing the low blood count," the doctor said. Finally, the results came back. "We found the problem," the doctor said. "Your blood count is low because of a vitamin deficiency. We can fix this with some changes in your diet." Emily was relieved. She learned that her blood count was important for understanding her health. By fixing the issue, she felt better and had more energy. The blood count was no longer a mystery, but a helpful tool to keep her healthy. Quick test. Multiple choice. What does the term blood count refer to? A. The number of times blood is donated. B. A medical test that measures the number of blood cells in the body. C. The process of stopping bleeding. D. The total volume of blood in the body. The correct answer is B. A medical test that measures the number of blood cells in the body. Why might a doctor order a blood count test? A. To check your cholesterol levels. B. To assess your overall health and detect various conditions. C. To measure your body temperature. D. To check the function of your kidneys. The correct answer is B. To assess your overall health and detect various conditions. Blood donor. A blood donor is someone who gives their blood to help people who need it for medical reasons. How to become a blood donor. Lisa wanted to help people, so she decided to become a blood donor. She learned that being a blood donor could save lives. The first step to becoming a blood donor is to make sure you are healthy. Lisa went to the blood donation center, and a nurse checked her blood pressure and asked her some questions. "We need to make sure every blood donor is healthy before giving blood," the nurse explained. Lisa passed the health check and was ready to donate. The nurse explained that a blood donor gives a small amount of blood and the body will replace it quickly. Lisa felt a little nervous, but the nurse told her it wouldn't take long, usually only 10 to 15 minutes. After donating, Lisa felt fine. The nurse gave her some juice and snacks to help her recover. It's important for a blood donor to rest and drink water after giving blood, the nurse said. Lisa was happy she could help and learned that a blood donor can give blood every few months. Becoming a blood donor was easy for Lisa, and she felt proud knowing her blood could help save someone's life. She promised to be a regular blood donor and told her friends how important it was. Now, Lisa encourages others to become blood donors too. Quick test. Multiple choice, what is a blood donor? A. A person who receives blood during surgery. B. A person who gives blood to help others in need. C. A person who tests blood in a laboratory. D. A doctor who specializes in blood diseases. The correct answer is B. A person who gives blood to help others in need. Why might someone become a blood donor? A. To increase their own blood supply. B. To help patients who need blood transfusions. C. To measure their blood pressure. D. To get a blood test done. The correct answer is B. To help patients who need blood transfusions. Blood pressure. A measure of the pressure at which the blood flows through the body. Checking blood pressure. Tom didn't feel well. He often felt dizzy and had headaches, so he went to the doctor. The doctor said, "Tom, we need to check your blood pressure." Tom didn't know much about blood pressure. The doctor explained, blood pressure shows how hard your heart is working to pump blood. If your blood pressure is too high or too low, it can make you feel sick. The doctor used a small machine to check Tom's blood pressure. "Your blood pressure is a bit high," the doctor said. High blood pressure can be dangerous if we don't control it. It can cause heart problems or even a stroke. Tom was surprised. He didn't know that blood pressure could affect his health so much. The doctor told him to eat healthy food, exercise, and avoid too much salt to lower his blood pressure. "It's important to check your blood pressure regularly," the doctor said. "Keeping it normal will help you feel better and live a healthy life." Tom started following the doctor's advice. He checked his blood pressure at home every day and noticed it slowly improved. He realized how important blood pressure is and promised to take care of it to stay healthy. Quick test, multiple choice. What does the term blood pressure refer to? A. The speed at which blood flows through the veins. B. The force of blood against the walls of the arteries. C. The amount of blood in the body. D. The process of blood clotting in the body. The correct answer is B. Blood pressure refers to the force of blood against the walls of the arteries. Why might a doctor measure your blood pressure? A. To see if you have an infection. B. To check if your heart is working properly. C. To assess your bone density. D. To determine the level of oxygen in your blood. The correct answer is B. A doctor measures your blood pressure to check if your heart is working properly. Brace. A brace is a device worn on the body to support weak or injured areas, like teeth, legs, or back. Getting a brace at the dentist. Jenny was excited, but a little nervous. Her dentist said she needed a brace to fix her teeth. A brace helps make teeth straight, and Jenny wanted a nice smile. When Jenny arrived at the dentist's office, the dentist explained how the brace would work. A brace is made of metal brackets and a wire. It helps move your teeth slowly into the right position, the dentist said. First, the dentist cleaned Jenny's teeth. Then, he carefully put small brackets on each tooth. "These are the parts of the brace that will hold the wire," he explained. After the brace was in place, the dentist gave Jenny some advice. "You need to take care of your brace by brushing carefully and avoiding hard or sticky food," the dentist said. "With the brace, your teeth will get straighter, but it takes time." Jenny looked in the mirror and smiled. She knew the brace would help her teeth, and she was excited to see the results in a few months. Now she knew how important it was to wear the brace and take care of it. Quick test, multiple choice. What does the word brace mean in a medical context? A. A tool used to measure heart rate. B. A device that supports or holds parts of the body in place. C. A type of medication used to reduce pain. D. A bandage used to cover wounds. The correct answer is B. A brace is a device that supports or holds parts of the body in place. Why might a doctor recommend wearing a brace? A. To help heal a broken bone or injury. B. To increase blood circulation. C. To prevent a fever. D. To reduce cholesterol levels. The correct answer is A. A doctor might recommend wearing a brace to help heal a broken bone or injury.